going to be talking about pigmentation beneath the eye area. It's a subject I don't like much myself because it's a problem that concerns me, and actually it's a problem that concerns a lot of my patients. So I thought today we'll discuss causes of what contributes to the pigmentation beneath the eye area, and then little tips on how we can go about treating or helping the appearance. Things we know that contribute to pigmentation beneath the eye area are lack of sleep and certainly dehydration. But try as you will to get as many hours of sleep as you can and hydrate as much as possible, you'll still see that this is quite a difficult or challenging problem. Further to that, what does contribute really is a change in the texture of your skin. So dehydration will allow for a more conspicuous appearance of fine lines certainly. Then with the maturing process, what tends to happen is we lose volume beneath this eye area and you start to appreciate a little bit of a trough or a dip in the skin beneath the eye. And you'll remember with a hill and a valley, light reflects very nicely over a hill, but not so much so over a valley. And that's why you tend to compound the appearance of the pigmentation in this area. How do we go about treating then? There's skincare, and that's what we can advise you on, and you can go about doing at home. And then there's a few in-room treatments that we'll discuss at the end of the vlog. Besides pigmentation beneath your eyes, many patients complain of puffiness as well, especially so for our hay fever sufferers. So I think it's always important to address the medical concern first, treat the hay fever as far as possible. Remember, if you have hay fever that's uncontrolled, oftentimes you're going to be scratching around the eye area. It's going to lead to a poorer lymphatic drainage. So address your medical concern. And from there are products certainly that can help with that puffiness. And I like NeoStrata's Intense Eye Therapy. It has in it a caffeine derivative, which really helps dampen down that puffiness very effectively. Skincare. Many people ask, is there any value to a cream beneath the eye area or an eye cream? I think certainly, provided you find the right cream. Now, when I'm looking for an eye cream, I'm looking for something that is not irritating, so without any fragrance particularly, that is effective and that stays put. You'll find a lot of eye creams actually tend to seep down your cheek, and they can cause a little bit of heaviness or obstruction. And I find myself in particular, I'm acne prone, so that leads to a little bit of an outbreak. Even in non-acne sufferers, the heaviness of eye creams can lead to an acne-like presentation called milia around the eye area. So it's important you choose something that, yes, is hydrating, but is not too heavy. Eye creams I really like and I think that are effective. SkinCeuticals Hydrating B5, a combination of B5 and hyaluronic acid, as well as Estherderm's eye cream. And I'll tell you why I like it, or I'll show you rather. You'll see it has a little bit of a peach tint to it. And you know, a peach tint will correct a bluish discoloration. Remember, you appreciate a little bit of a bluish discoloration beneath the eye area because the skin in this area is so thin, and so you can see the vessel plexus beneath. So the apricot shade goes to combat that blue tinge very nicely. We've talked correction, but I think the best place to start is always prevention. Many of us know we have to use a sunscreen, but we forget to sweep that along the lid margin. And many of us actually avoid that area because we find sunscreen entering our eyes can cause a little bit of an irritation or stinging certainly. So I think just to combat this, a nice tip is to use a physical protection sunscreen. You'll know my favorite is NeoStrata Physical Sheer, which is a nice physical blocker. Further, SkinCeuticals have gone one step further and they've introduced a sun protection specifically for the eye area, which stays put really nicely. How you remove product from your eye area is as important as what you're applying to this area. I think many of us are tempted in the evenings to take away our makeup as quickly as we can. Just resist the temptation. What I've introduced into my evening routine is Bioderma's Micelle Sensibi water. It's incredibly gentle, but still surprisingly incredibly effective. So all you do is apply a small amount to a cotton round, place against your eye area, hold for 5 to 10 seconds. That will absorb the makeup in the area very effectively, and then glide away from your eye area gently. Avoid circular agitating movements. What this can do is lead to a complication called cutaneous amyloidosis. And amyloid is a pigment we get in our skin. It's a brownish gray pigment. So increased irritation leads to an increased deposition of amyloid and can contribute to an exacerbation of pigmentation beneath the eye area. Eyes are such an important feature on our face, and they express so much. So it's important to treat the skin around the eye area, especially if you have pigmentation. It can lead to concerns about you looking a little tired, fatigued. People can say, or might comment that you perhaps look a little sad. So I think with correction of these changes, what you can do is shift the focus once more from beneath the eye to the eye. So we reintroduce a bit of the spark.